Welcome, everyone, to the Understanding Your Medical Insurance webinar. I'm going to wait here for just a minute, give people a couple more minutes to get logged on, and then we'll get going. So hang tight for just a few here. For those of you just getting logged on, we're going to wait just another minute or two here to give people time to get logged in. This is the Understanding Your Medical Insurance webinar. All right. Welcome everyone to today's webinar, Understanding Your Medical Insurance. My name is Maria Royal. I'm a part of the Washington Wellness team, and I am happy to be taking you through this training today. Starting with just a quick housekeeping note, you got to have it. I want to start first by making sure you understand the purpose and content of this webinar, and then what to do if you have questions. So uh, within the state of Washington, we have many different plans that are available to several different populations across the PEB, SEB programs, and then also the Medicare programs. So we won't be covering the details of each individual plan or really any individual plans here. I don't want to disappoint anyone, have you heading into this thinking that you're going to be able to take a deep dive on the plans that are available to you, because that might be different from another person on this call. Um, and I did get a lot of specific questions leading up to this webinar that I can't answer. So any questions that you have still should be directed to either HCA support. I'll drop that link in the chat there. Your benefits office, or if you're able to attend a benefits fair in person, we will have plan representatives, and those are occurring over the next couple of weeks heading into open enrollment. There's also the virtual benefits fair if you're not able to attend an in-person location. You should already be muted, but we will keep an eye on that in case anybody gains the ability to unmute. This webinar recording will be posted at the Smart Health for PEB and Smart Health for SEB pages shortly. I will also drop those in the chat here in just a second. And then any questions that we see come through in the chat, I will do my best to collect those and pass them along to the support team. Don't want to take any risks of answering questions myself. I'm just here as the training lead to help you understand generally, right, how our medical insurance plans function. So what we'll cover today, starting with some considerations when you're choosing your medical plan. A lot of times people will get enrolled when they are first hired, they're overwhelmed, they just kind of choose a plan and go with it. And then if you aren't careful, you can end up over time when things change, enrolled in a plan that might not be a great fit for you. So we'll start by covering plans that are available in your county, the types of medical plans we offer, different costs associated with medical insurance, flexible spending arrangements, and then a few additional points of consideration. All of this meant to empower you with the information and resources that you need to make a choice that you feel confident in. And then kind of a different ball game. How do you use your plan once you're enrolled in it? Again, that can be overwhelming if you're not sure where to start. So we'll talk about covered benefits, navigating the network, behavioral health services, additionally, touch very briefly again on the flexible spending arrangements, some medical plan resources, and documents. So we'll start with a few things to consider when choosing your medical plan, beginning with one of the most basic ways to filter out your plan choices, plans available by county. So not all plans are available in all counties across the state, or if any of you happen to live in a state that is not Washington, that availability, of course, is extremely important for you as well. And then for some plans with tighter networks, that county availability can change year over year. So a great place to start is the PEB or SEB webpage. Hopefully you know whether you want to be looking under the PEB banner or SEB. PEB is all public employers. So that includes higher education, Department of fill in the blank. And then SEB is school employees. So it should be fairly easy to figure out if you work for a public school in the state of Washington. But a great place to start is whether that you're supposed to be landing on the PEB or the SEB webpage. Look for medical plans and benefits, and then medical plans available by county. You can also use the medical plan comparison tool, which will automatically filter out plans available to you based on the county you select. That is another link that you'll want to find and kind of navigate your way through. If you happen to live in one county but have a physical work location in another neighboring county, you do have the option to enroll in plans available in the county in which you work as well. So keep that in mind. If this is the case for you, consider searching for plans that are available in your work county as well. That might make a difference in which plans you end up considering. And then I'll also note one more time here, we have two different employee populations being addressed in this webinar, public employees or PEB and school employees or SEB. So just keep in mind which one applies to you and make sure as you're navigating our website that you're on the right webpage. So once you see all the plans available for you to choose from, you'll see a few different numbers probably right away, all of which we'll define in a few slides. But it's also important to understand the difference in how these plans operate, not just the difference in price. The first plan network type that we'll look at are managed care plans, also called health maintenance organizations or HMOs. These plans require you to designate a primary care provider within their network of physicians to oversee and coordinate all of your healthcare needs, like any specialty referrals. These types of plans may not pay for your care if you see a non-network provider. So, for example, if you have a doctor you've been seeing for a number of years and you enroll in a managed care plan without checking that provider network first, you may find yourself in a situation where you're either paying out of pocket to see your primary care physician if switching is not an option for one reason or another, or the alternative is possibly needing to switch providers for a time until you can change your medical plan back to something that your provider is contracted with. So navigating this network scenario does not apply to emergency services. So if you're ever traveling out of network and you experience a need for emergency care, you do not need to worry about navigating that network before you receive medical care. Just get yourself to the ER. And then if that turns into an extended care situation, the hospital can coordinate with your insurance at that time to transfer you to a facility within your network for ongoing care. Or again, if you're traveling outside of your medical plan's network, coordinating ambulatory services to get you back within network. And then here you'll see a list of the PEB and SEB managed care plans, primarily Kaiser Washington and Kaiser Northwest. And then on the SEB side, we see one Premera Blue Cross HMO plan as well for SEB. The next type of medical plan network we'll look at are preferred provider organizations or PPOs. These plans allow you to see whoever you want, whether that's an in-network or out-of-network provider, but they will provide a higher level of coverage if the provider is in their network. This might be the difference between having 50% of an office visit covered if somebody's out of network versus 80 or 85% for an in-network provider. So you can see the difference. It's going to impact you, have an effect on your bank account, seeing somebody in network or out of network, but you are still covered just at a lower rate outside of network. These plans generally offer more flexibility than the managed care plans. So if that's a priority for you, this would be a good option to consider. And then again, the PEB PPO and SEB PPO plans are below Uniform Medical Plan for both the PEB and SEB sides. And then the Kaiser Washington options and Premera Blue Cross also have a PPO option on the SEB side of the house. And finally, the last of the types of medical plan networks that we'll consider are our consumer-directed health plans, also called high-deductible health plans. So you might hear these referred to as CDHPs or HDHPs. These plans have higher annual deductibles and out-of-pocket maxes than the managed care and PPO plans we just viewed, but that high deductible is offset by generally lower monthly premiums, as well as an employer-funded health savings account that you receive funds into on a monthly basis. And then you also have the option to put your own funds into as well. So the deductible and the out-of-pocket max are higher, and that is offset by the lower deductibles, by the lower premiums and the employer automatic contributions into your health savings account, or HSA. High deductible plans can be a bit more work to understand and maybe take a bit more of a mental load to stay on top of your own expenses versus just kind of running everything through insurance to pay first and waiting to receive that bill to see what your portion's going to be. You kind of expect to pay, be responsible for paying the full amount of a lot of medical services, at least to start the year. But that does not make them lower quality plans. It's just a different kind of flow of expenses here. And then we have high deductible options through Kaiser Northwest, Kaiser Washington, and the Uniform Medical Plan. We will touch on these high deductible plans a bit more in a few slides as well. So now we're getting into the costs associated with medical insurance. And these healthcare costs do come from a few different directions. So we'll kind of define a few terms here, starting with premiums. Now, for some people who maybe have not paid a ton of attention to their medical plans in the past, premium may be the only deciding factor that leads to choosing one plan over another. Think like the first time you're choosing a medical plan after you are taken off of your parents' insurance. You're young and single and just trying to take home as much money as possible, right? So that is the first thing that kind of grabs your attention. But as you're hopefully picking up by now, the monthly cost taken from each paycheck is only one small piece of the puzzle, one part of what you need to consider to make a choice you're happy with. So a monthly medical premium is the amount you pay for a full month of coverage in a medical insurance plan. You may also pay premiums for long-term disability insurance, supplemental life or accidental death and dismemberment insurance through the state are the other plans that you may have premiums associated with through the PEB and SEB programs. So when we talk about premiums, this is whether or not you use the plan at all any given calendar year, you're still going to pay this amount. So if you choose the medical plan with the highest premiums, it's the Cadillac of insurance, if you will, and you had a year where you're completely healthy, didn't see a doctor once, you still paid them that amount of money to have that level of coverage, right? So again, one piece of the puzzle, one thing you want to consider, but not the only thing you want to consider. Next up is deductible. This is a fixed dollar amount you are responsible for paying each calendar year for covered healthcare expenses before your plan starts paying, kind of sharing those expenses with you. So a lot of people get hung up on this one when they look at, let's say, an office visit and you have a plan with a copay. And so you're thinking, it's January 1st, I need to go to the doctor. It says an office visit is $30. So I'm going to go in and I expect to pay $30. But you haven't paid anything towards that deductible yet. And that $30 applies once you have hit your deductible. Stay with me here, okay? So again, say you're paying $100 a month in premiums for your plan. You go to the doctor early in the year because you're sick and you end up needing to run some tests. If your annual deductible is $500, you will pay that first $500 in medical expenses out of your own pocket. So that $30 office visit copay does not apply yet. Then once you've hit your deductible, you've paid that $500, you're now sharing expenses with the insurance plan. So if you were to go to the doctor again later in the year, same scenario, maybe you're sick, need to run some tests, do some diagnostics. But now that you've already hit your deductible, you might pay that flat $30 copay or 15% of the cost of an office visit. And now the insurance plan is going to pay 85% for you. So deductible, it can be pretty consequential at certain points in the year for you. A few other things to know. Some medical plans may also have a separate annual deductible for prescription drugs. Again, that can be pretty consequential depending on what your needs are and how much you plan on using your prescription benefit. So just be prepared there, take a look at that and know what you're signing up for. And then you also need to know that some benefits like your preventative care, annual well visits, and routine vaccinations do not require you to pay your deductible first. So a short list of things are covered regardless of whether or not you have hit your deductible yet. And then we will mention this several times throughout this presentation. You can also reduce your annual deductible if you're in a low deductible plan, one of the non-CDHP or HDHP plans. You can reduce this deductible by $125 through the Smart Health program every year that you're eligible for it. And so right now, if you haven't done anything in Smart Health, you do still, as of the date of recording this, October 17th, you do still have some time to get into Smart Health and earn your points. And then when January rolls around, using my example from earlier, whereas you previously had a $500 deductible, just by participating in Smart Health and putting some time each day towards your personal well-being, that $500 deductible could drop to $375. So this is free money available to you that a lot of people leave on the table. We always want to see our Smart Health participation increasing. And so I hope this motivates you to get into Smart Health. Feel free to reach out for help if you need help troubleshooting getting into your account. But again, that's $125 available to you, and we want you to take advantage of it. All right, and now we're talking about copay and coinsurance. I did just use examples on the last slide that illustrated copay or coinsurance. But this is the amount you pay for covered services once you've hit your deductible. A copay is a fixed amount and a coinsurance is a percentage. So this can vary from plan to plan. Usually, in most cases, not an enormous difference between the copay and the coinsurance, but that's not always the case, right? Some plans might have you pay $30, $40, $50 for some complex imaging. And other plans might have you paying 15 or 20% of the full cost of that complex imaging. So another thing you want to think about as you look at the differences from one plan to the next is how do you reasonably expect, of course, you can't see into the future, you won't know everything, but what do you know? Do you know you need imaging on a regular basis? Then look at how imaging is covered across different plans and see if there is a significant difference for you. Um, so some people like to know what to expect when they make an appointment. Again, easy example is an office visit. It's nice to know that's going to cost me, uh, you know, 20, 30, $40. Um, so if knowing ahead of time is important to you, you might want to consider a plan with a copay. Otherwise, a co-insurance, it's nice to see that your plan is covering a significant amount. 85% is a pretty standard kind of average amount of what the plan might pay once you've hit that deductible. And so just kind of a small difference in the terminology here between copay and co-insurance. And that's the reason you'll see some dollar amounts and some percentages as you look through the different plan options. And then finally, we have the annual out-of-pocket max. This is the most you would pay in a calendar year for covered benefits. So if you have extensive medical needs or financially need to know what your bottom line would be in a worst case scenario situation, pay attention to your out-of-pocket max. They do vary quite a bit from plan to plan. And for a few considerations here as well, some, as with deductibles, some medical plans may have a separate out-of-pocket max annually for prescription drugs. So again, are you somebody who takes expensive prescription medications on a monthly basis? Pay attention to whether there's a separate out-of-pocket max and a separate deductible for prescription versus medical. Your deductibles, co-pays, and co-insurances all apply towards reaching that out-of-pocket max. And once you have hit that number for the year, your plan will pay 100% of in-network services with few exceptions for the remainder of the year. Most of the time, we don't plan when major health events happen to us, but it's something to consider if you're, for example, planning to become pregnant, or if you have a medical procedure that's not immediately urgent. January is kind of an unfortunate time to have a big expense if you had already hit your last year's out-of-pocket max. That might be the difference between paying the full amount for a given procedure or, childbirth, versus having it covered at 100% if that had happened in December because you'd already hit that out-of-pocket max. So again, in the we'll call them rare events where you can plan ahead for your medical needs. This is something you want to keep in mind. And now talking a bit about flexible spending arrangements or FSAs. This is an account that allows you to set aside pre-tax money from your paycheck to pay for out-of-pocket healthcare expenses for yourself and any qualified dependents. Setting aside a portion of your pay with an FSA also reduces your annual tax burden, your annual taxable income. The other thing that is great about flexible spending arrangements is that the full amount you elect to set aside for your FSA is available on the first day your benefits become effective. So many state employees are paid twice a month. That's 24 paychecks in a year. If you enroll during open enrollment in a flexible spending arrangement in the amount of $2,400, once January 1st rolls around, you will have an account with $2,400 in it ready for you to use. You could spend it all on January 1st if, again, you had some sort of a procedure coming up. But all of that amount is available to you on that benefit effective date, right? And the impact that this has on your paycheck would be $100. Every time you get paid, 24 times throughout the course of the year, that's $100 missing from each paycheck. but $2,400 ready for you on January 1st. So the front loading benefit of flexible spending arrangements can make a significant difference for some medical care. Both the PEB and SEB programs offer a medical FSA, which covers a wide range of health expenses, medical expenses included in that. That's the significant difference between a medical FSA and a limited purpose FSA. You can also browse through the qualified medical expense list on the Navia benefits website that lays out what exactly is an allowed expense within an FSA or a medical versus limited FSA. The limited purpose FSA covers only dental and vision expenses. Medical is not included. And the benefit to this is that you can be enrolled in a high deductible health plan with a health savings account, as well as a limited purpose FSA at the same time. So you can kind of reserve that HSA for medical expenses, put some funds into a limited purpose FSA to cover your dental and vision expenses. So you're kind of coming at it from both sides there. So kind of putting all of this together to help you choose a plan, right? If you can do this, it's very helpful to calculate how much you have spent in the past calendar year on your medical expenses, premiums, deductibles, co-pays, any other out-of-pocket costs not covered by your plan. And if you have an account set up on your medical plans, kind of web page where you can create an account, a lot of times they'll have kind of like a ticker saying, hey, here's your full, here's what it takes to hit your deductible. Here's when you satisfied that. This is how much you've spent on medical expenses so far this year. But again, go through and calculate. If you're somebody in the example that I used early on, you might be spending thousands of dollars each year on a pretty rich medical plan that you used very minimally. That can be illuminating to you. Maybe I'm overspending. If we're talking about, risk stratification here, I am paying too much for, functionally the risk strata that I am in currently. Or you might find out I'm paying low premiums, but that's resulting in a lot of money coming out of my pocket for medical expenses. Maybe it would be better for me to balance that a bit more by choosing a plan with higher premiums, but a lower deductible. So I'm not paying quite as much out of pocket. Those surprise bills are harder for me to kind of weather than if I just had a bit more coming out of each paycheck, right? And then looking at those expenses that you've made over the past year, you can also consider reducing those costs or kind of lessening the burden of those expenses through the FSA that we just talked about, a limited purpose FSA, or the health savings account. If you're somebody who just wants to be in control of your medical expenses, those high deductible plans with the health savings account can be a great option for you. And that, again, includes the savings that you are receiving through your employer contributions. That is automatic. You don't need to do anything to set it up, and it is money that's deposited into that account every month for you to use. So if you were to go onto the HCA website and find that medical benefit comparison tool, it's in a different location for the PEB and the SEB plan. So again, make sure you're in the right spot. But let's take a look at what medical expenses might look like throughout the course of a year. So opening up that medical benefit comparison tool, you'll select the county that you reside in. And then again, if you're somebody who works in a different county, you can also select the county that your work is located in and see if that makes a difference. We're kind of putting all of the previous slides together here to give you a real life picture of what that might look like. So here in this example, I am a PEB employee in Garfield County, Washington, choosing 3 different levels of the Uniform Medical Plan to compare for 2025. Once you continue on here, you can tick that tab at the top that says only show benefits that are different. That's helpful for someone like me where I just want to see, okay, what are the actual differences here? I don't need to know all the information. I just need to know what's different from one plan to the next. And this isn't on the table, but I want to start by saying here that if you're enrolled in each of these plans for a full year, your premiums in the CDHP would be $552 annually, right? And then you're also receiving $700 back through the employer contribution to your HSA. So again, it's offsetting that higher deductible through the low premiums and the employer contribution. So again, $552 annually to be enrolled in the Uniform Medical Plan, CDHP. The Classic Plan in the middle there is going to be $1,596 annually. And then the Select Plan, it comes out to just under $1,000, $996. So there's between the CDHP and the Classic Plan, there's over $1,000 difference in what you're saving on premiums. And then the Select Plan kind of lands in the middle. So keep that in mind when you're considering your annual medical expenses, right? It's just one piece of the picture. So weigh that against the deductible. Higher premiums, lower deductible, vice versa. Would you prefer to pay more upfront or less from your paycheck taken each month and pay more when you seek services? What works for you might be different from what works for someone else, and that's a decision you make based on your own preferences and financial needs. Then continue down the page. You can see the different benefits and what you can expect to pay. So let's see, a routine annual exam for a hearing exam on the CDHP, you'd pay 15%, and it's $0 on the Classic and Select plans. A lot of the rest of these numbers are really pretty similar. 15% to 20%, one plan to the next. That's probably not on its own a deciding factor. Prescription information is on here as well. So be aware of what types of medications you're taking, what tier they might fall in, and again, if there's going to be a significant difference for you. And then going back up, I should have mentioned this earlier, but you can also look on this medical benefit comparison to see if there is a prescription drug deductible. So you'll see in the CDHP, it's combined with your medical deductible. So that number you see at the top, $1,650 per person or $3,300 for a family, that's your deductible. You don't have to worry about a separate prescription deductible. On the other plans, you have a medical deductible and then a separate prescription deductible and separate prescription out-of-pocket limit. So again, just keep that in mind. Unless something major changes in your health, you should know if you're somebody who is going to spend a lot on prescriptions based on what you've experienced in the last 12 months. And then again, if something changes, it's just something to keep in mind moving forward. Considering level of care, when it comes to pre-existing conditions, there are no restrictions or waiting periods with PEB or SEB plans. But for those of you that have pre-existing conditions and may have been receiving care in recent years, you'll want to be sure the plan you choose will work for your existing care team. The doctors, clinics, specialists, hospitals, pharmacies, etc., that you have been utilizing. This could be a significant disruption if you choose a managed care plan that does not have your existing providers in that network. You can visit the plan's websites individually to search their provider directories. You can also call their customer service lines to verify which providers are in network. Some people like to start by asking the clinic if they accept a certain type of insurance, and that is not the most reliable source. You want to start with the plan and ask who's within their network. Also consider that your needs may change through stages of life. Your age, your marital status, children, health status, so on and so forth. When these stages of life change for you, that should kind of trigger you to think about what level of care am I receiving, and is that appropriate for what my needs are at this point in my life? So again, verify your network with your plan, call or check the PEB and SEB websites. And then this stages of life call out here also applies to other types of insurance like life and long-term disability. Essentially, what we're saying here is pay attention to what your insurance needs are. At least think about it once each year. And maybe something will come to light that you hadn't considered before and prompt you to think if there's a different plan that might fit your needs better. If you have other medical coverage available to you through a spouse, partner, or parent, you'll want to consider what that other coverage looks like. If it's available through the PEB or SEB programs, dual enrollment is not allowed. So you cannot have your own insurance through the SEB program and be covered by a parent, meaning you're a dependent on their plan through the PEB program. You cannot have PEB or SEB coverage under both your account and another person's account. You also can't do this. You can't be enrolled under your own account and as a dependent within PEB or SEB. So it goes across the PEB and SEB programs, and within each individual program, dual enrollment is not allowed. You'll also want to consider an example that comes to mind is if you're going to be turning 26 in the coming plan year, would switching to or from other coverage disrupt your care or increase your costs? So if you're being treated for something and then partway through the year you age out of dependent status and you have to go on to your own plan, you might be starting over in a new network with a new annual deductible and out-of-pocket max if you switch mid-year versus going onto your own account now. So again, something to think about, and that's a good call out to contact your benefits office and talk about how they can help you through that process if you do foresee a situation like that coming up. And then one more touch point on the high deductible plans with health savings accounts. These high deductible plans need a bit more information to understand how they truly compare to the other plans. So hopefully when I say high deductible plan, you're already kind of automatically thinking that high deductible is offset, again, by lower premiums and employer contributions into your HSA. If you stay enrolled in a CDHP or an HDHP for a full year, you will receive nearly half of your annual deductible paid back to you through these employer contributions. They do come on a monthly basis, so it's either $67 a month or $114 per month, I think. My math might not be right there. But you can choose to make your own pre-tax contributions into your HSA as well, which saves you even more on your healthcare costs. You can receive $125 into your HSA each year, an additional $125 by participating in Smart Health and earning that incentive. And then there are also multiple ways to manage expenses with your HSA, including payment plans and reimbursement. The HSA does start with a $0 balance, and that can be pretty intimidating when you have a high deductible that you're staring at. But if something happens, You can set up a payment plan. You could pay out of pocket and reimburse yourself once that HSA balance has built up a bit. There's really, really great flexibility within the HSAs. And then finally, the funds in your HSA remain yours. Even if you change plans or employers, you own this account. So there's never going to be a situation where you would forfeit the remaining funds, which can happen in flexible spending arrangements. You fully own these funds. So the HSA, again, it takes a bit more explanation, but it is a really great benefit that goes along with these high deductible plans. And now shifting gears a little bit to look at how to use your plan once you're enrolled. A few things you want to know about when we're talking about covered benefits. You should be generally familiar with what's covered by your plan after looking through that plan comparison chart as you're making your decision. But specific benefit details and limits for covered benefits are going to be detailed in your plan certificate of coverage, also called an evidence of coverage. You can find these on our forms and publications site. Once you've paid your annual deductible for covered services, again, you'll pay a copay or coinsurance until your total costs reach that out-of-pocket maximum. So that's kind of that level of care that you're paying for, right? And then we've mentioned this previously as well, but call back to the fact that some benefits are covered without paying that annual deductible first. These include your annual physical exams and screenings, routine vaccinations, the diabetes prevention and management programs that are kind of designed to help you make tangible improvements in your health. And then tobacco cessation programs as well are free to you regardless of whether or not you have hit that annual deductible. Navigating a network can be challenging, but this is an important step to making sure that you're receiving the best rates for your care. So to find providers in your medical plans network, there's a few different ways you can do this. You can visit the Healthcare Authority's website. You see on the screen there, hca.wa.gov/ERB. Select public employees or school employees, medical plans and benefits, and then find a provider. We can, at the end of the presentation, actually close out of this and then navigate over to find a provider. We can also visit your medical plan's website or search for their provider directory. And then you can also call your medical plan's customer service if that's easier for you. Demand for behavioral health support is increasing as well. And there are many ways to support your mental and behavioral health outside of talk therapy. If you've ever felt like my mental health is struggling a bit, I should get in to talk with a counselor. It can be hard finding an in-person counselor that is accepting new patients. It can be cost prohibitive depending on, where you're at and what's realistic for you. And there might be a significant wait time. If we start before we're at crisis mode and just consistently commit towards taking steps to improve our mental health, you don't necessarily need that in-person counseling. I don't want to discourage anyone from seeking counseling, but if you don't feel that you're in kind of crisis mode yet, but you feel like you need some support, all PEB and submedical plans provide a variety of behavioral health services, including in-person counseling, but also including things like self-care and meditation apps, phone or video-based coaching, classes and support groups. There are really a lot of options being implemented to try and lessen that burden on clinical settings, right? So find more information, again, by starting at that ERB website. Select your employer group, public employees or school employees. medical benefits and plans, and then behavioral health services by plan details what you have access to. As far as I know, these are all free to you, at least for 1 year when we're talking about like app subscriptions. But again, making a consistent effort before you're at crisis mode can really make a big difference. Don't discount the power of just small, consistent efforts. So please don't wait until you're in crisis mode to pay attention to your mental health. These benefits exist because there's value to them, and we want you to take advantage of them. So to learn more about your plan, look through those medical plan documents like the certificate of coverage or summary of benefits and coverage. Hopefully you feel a little more prepared to navigate the HCA website, find the public employees or school employees page for you. A lot of what we've talked about today is going to reside under medical plans and benefits. And then find your medical insurance carrier. We have many forms and publications on our website. You can also find a lot of those on the plans website, or again by calling any specific plans customer service to request printed documents, or if you need a card reissued, or really anything you need help with when you're navigating the actual plan benefits, you'll want to contact that customer service. So a few resources. The HCA page is just stuffed full of information and resources. So helpful to know kind of where you're heading when you head out to the HCA website. Hopefully we've pointed you in the right direction. You can also contact your organization's payroll or benefits office, your medical plans customer service, and then also encourage you to consider attending a benefit fair to visit different vendors or poke through the virtual benefits fair if there's not a location that is feasible for you to reach in person. All right, and I'm gonna hop over to a browser and show you around that ERB website. If you haven't looked over there yourself yet, I'll kind of, again, give you kind of a heads up what to expect there. All right, so switching screens now, you should be seeing the Washington State Healthcare Authority. I'm not going to take requests for can you show me how to find XYZ, because I will end up just hopping all over the place and getting myself distracted, but I'll visit a few of these locations that we have mentioned in this presentation. So here you can see this banner at the top, PEB and SEB open enrollment, and that has links for PEB retirees, PEB employees and continuation coverage, and then SEB employees and continuation coverage. So if you want more information on open enrollment or benefits fairs, you'll want to start here. Employee and retiree benefits. If you scroll down, you'll see explore your PEB benefits or explore your SEB benefits. Here is a link to that virtual benefits fair if that's something you wanted to check out. If we scroll down a little bit more, sorry, find benefits here in this box. And then, as I mentioned, we spent a lot of time on this medical plans and benefits page. And then navigating here, we mentioned comparing medical plans. This uses the benefit comparison tool, and then there's also like a printable resource. And again, I'm just on the public employees page, but this should look very similar on the SEB side. And then medical plans available by county here as well. Find out which plans are offered in the county you live or work in, because you can enroll in plans that are offered in the county you work in, even if they're not available in the county you live in, right? Find a provider. So we're looking under plan resources now, contact the plans. Benefits and coverage by plan, that calls out the plan's benefit booklets, summaries of benefit and coverage. Pre-authorization criteria. Here's that behavioral health services by plan link. And down below, wellness programs. So you'll see diabetes prevention. The SEB side will include diabetes management, smart health, and living tobacco-free. So I'll just also click through a couple of these to show you what they look like. We mentioned starting with medical plans available by county. You can jump down the page here. And as I mentioned, this can change year over year. So make sure you're looking at 2025. So you can expand this and it'll show the plan name and which counties it is available in. Taking a look at that benefit comparison. So here's the printable resource. And then there's different 2024 and 2025 resources. And then we can also switch this over to the SEB side and find the SEB plans. Let's look at the comparison tool. So this should be pretty user-friendly here, but make sure you've got the right year, the type of employee that you are, and what state you live in, and what county you live in. And then you can choose up to 3 plans to compare at a time. So I'm just gonna choose 3 random plans. And then here's where you can click that tab to show me what are the differences. And remember, this is just one piece of the puzzle. You also want to pay attention to your premiums. Oh. And then let's also pop over to the behavioral health services by plan page. If you need immediate assistance for a life-threatening emergency, call 911. If you are in crisis, text or call the Suicide Crisis Lifeline. Those are there for a reason. We want you to use them when you need them. And then when you scroll down, it breaks them out by plans. And again, you kind of have different levels of care here, right? If you need help right now, if you feel like you need it very soon, but not in this exact moment, versus if you just feel like I'm not doing great and I probably need to put some effort in to improve where I'm at. And so each of these are going to look a little bit different for the different plans. Oh, I like talking with kids about mental health. So these resources are expanding all the time as we find more things that are helpful. Yeah, so you can look through the different plans. There's information on like Brennan's Law. This Uniform Medical Plan one tells you about the different offerings. So Doctor on Demand, you can talk to a board certified physician, counselor, or psychiatrist anytime by video chat, 24/7, 365. Quartet is like it's a program that helps match you with a provider that's accepting patients right now and fits your needs. My Strength is an app. So all of the different plans should have something similar, right? So look through the different resources and access to treatment for each of the different plans. And again, if you're somebody that this is a significant priority for you, you might find that one plan has something that seems like it's going to be a better fit for you, and that could be a deciding factor. So tons of information here. Make sure you get to this website. Start with hca.wa.gov/ERB. And again, make sure you've got the right website, whether that's PEB or SEB. And feel free to reach out if you need more help. I hope this was helpful. That's kind of a ton of information to cover, but hopefully we've given you the tools and the understanding you need to feel empowered, to move forward, make your own choice and know how to evaluate if it feels like it's time to consider something new. So thank you all so much for attending.